Good day, dear students. I am Chmedronov Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University, and now we will talk about artrosyndesmology. The study of the bone connection providing mobility of various parts of the body has not only theoretical but also practical significance. Damage to joints and other types of bone connection is perhaps one of the most common causes of disability that a doctor has to deal with. Bone joints are studied by syndesmology or artrosyndesmology, and you may see this term on this picture. So, bone joints serve several functions. This is firstly the function of fastening individual bones into the whole human skeleton, integrity of the body. Second function, bone groove. A bone groove occurs at the junction between the bones. Bone tissue, unlike others, grows only by apposition, the imposition of new bone substance on the existing one. Naturally, the growth of the skeleton occurs along the surface of the bones and in the places where they are connected to each other. And you can see on this picture, on this X-ray examination, the skeleton of child. And also you can see small clefts between parts of bones. For example, you may see the femoral bone and small cleft between the head of this bone and its body. And this is cartilaginous tissue, which is invisible in X-ray examination between these parts of bones. And this cartilaginous tissue is the bone factor growth for this femoral bone. And adult people on adult organism, there is no cartilaginous cleft between these parts of these bones, and the bone growth is complete. So the third function is that movements occur in the joints between the bones. And the first function is the connection between the bones, which are carried out due to the soft form of connective tissue or cartilage, are springy, in which shakes and contusions are damped and absorbed during body movements, walking, running, and jumping. Damping shocks and vibrations. Like spring, you may see our column, vertebral column, is like spring. And the main function is damping shocks and vibrations. So next we will talk about stage of development of connection between bones. So artrosyndesmology in phylogenesis. Types of bone connections, there are two types. Solid type and discontinuous type. The early stage of development in the skeleton is solid, and we will see this type of bone connections in primitive animals like fishes. And the next type is discontinuous with more extensive movements. As the skeleton differentiates, joints appear. And all through these stages we can see in autogenesis. And first earliest stage of bone development, of bone connection development, is synarthrosis, an immovable bone connection. And next we can see the symphysis or hemiatrosis, a slightly movable bone connection. And at last we can see diarthrosis or joints, a freely movable bone connection. And all these stages we can see in adult person. So next we will talk about common classification of bone joints. And as I told you, in adult we can see all the bone connections. So we can see solid connections and joints, movable connections. So solid connections, they are synarthrosis, which contains three parts: syndesmosis, like ligaments, interosseous membranes, sutures, gymphosis, spondylosis, and fontanelles. Next, there are synostosis and synchondrosis, which contains on two groups, temporary and permanent. Next, also we will see in adult person amphiarthrosis or symphysis or hemiatrosis, and third, diarthrosis or joints, which contains on three groups: anaxial, biaxial, and triaxial. So, first, detailedly, we'll talk about synarthrosis. And first part of synarthrosis, I told you, articulationis fibrosae or syndesmosis. So, we can see all this connection between bones, and detailedly, I told you and tell about this connection. So, the most common type of synarthrosis is syndesmosis, fibrous joints. In them, the bones grow together through dense fibrous connective tissue. In fibrous joints, the base is formed by thick bundles of collagen fibers. You may see this or this, between which there are elastic fibers. As a rule, these compounds are dominated by collagen fibers, the main carriers of the mechanical properties of syndesmosis of high strength and low elongation. In turn, syndesmosis are subdivided into membranes. They are located between two adjacent bones or close openings in bones. They are characterized by a course of fibers, usually have holes for the passage of blood vessels and nerves. These include, for example, the interosseous membrane, membrana interossea, it's in Latin, connected the radius in ulnar bones of the forearm along the entire length, connections of the ankles of the fibula and tibia, spliced by means of large bundles of collagen connective tissue fibers, obturator membrane, you may see this, of the pelvic bone. The next form of syndesmosis is the sutures of the skull. The edges of the bones are connected to each other at the sutures with the thin layer of dense fibrous connective tissue. These are very strong adhesions because in the sutures of the bones of the skull, the connective tissue consists of short, strong bundles of collagen tissue, connective tissue, that grow into the junction of the bones and penetrate into the main substance of the bone tissue. In serrata sutures, for example, between the frontal and parietal bones, the edges of the bones are serrated, and the teeth on one bone go between the teeth of the other bone. The bone's gap between them is twisted with dense fibrous connective tissue. In squamosal sutures, you may see this on this picture, between the squama of the temporal bone and the parietal bone, the obliquely cut edges of the bones overlap each other like fish scale. There is also fibrous connective tissue between the edges of the bones. The bones of the facial skull are spliced with the cartilaginous flat sutures. The edges of the bones are smooth, flat, but here between the bones there is a layer of dense fibrous connective tissue. The fontanelles are also referred to as syndesmosis, the connection between bones in newborn child. The third type of the syndesmosis is ligaments, or ligamenta in Latin. In this case, the connective tissue takes the form of bundles. They can be located between the separate areas on one bone, between adjacent bones. They can be elements of the joints, like this, between femoral and hip bone. As a rule, they have low elongation and high strength. Some of them can withstand loads of hundreds of kilograms. So, elastic fibers predominate in the ligaments. It's also syndesmosis, but unlike the previous ones, in the structure of the yellow ligaments, such are in vertebral column between the arches of vertebrae. So it's not the bundles of collagen fibers that are of primary importance, but the elastic connective tissue is synelastosis. For example, there are yellow ligaments between the arches of vertebral column. Elastic fibers, unlike collagen fibers, can lengthen in 2 and 5 times, and after removing load return to their original position. So the arches of the vertebra are connected by yellow ligaments. You may see this on this picture. They create a strong elastic tension on the dorsal side of the spinal column and help to straighten it. The knuckle ligament contains many elastic fibers. It helps to keep the head and their organs in a balanced position. A variety of syndesmosis are the joints of the roots of the teeth with the maxilla and mandible. This is gomphosis, or in Latin, gomphosis. The root of the tooth is inserted into the hole in the jaw like a nail driven into the wall. However, there is nothing between the metal of the nail and the wall, and it's the junction of the tooth with the jaw between the root of the tooth and alveolar. There is a layer of fibrous connective tissue, the alveolar periosteum or periodont. Its constituent fibers grow on one side into the alveolar, on the other into the cement covering the tooth root. The next type of hemiatrosis is Synchondrosis, or Articulationes Cartilaginea, it's in Latin. Synchondrosis is the type of bone connection which contain cartilaginous tissue. Cartilage tissue has significant elasticity and hyaline. By type of cartilage, there are two types of cartilaginous connection: hyaline cartilage and fibrous cartilage. And on this picture you may see, for example, the cartilaginous connection between first rib and breastbone is synchondrosis with hyaline cartilage. And for example, the fibrous cartilage you may see on this picture. This is intervertebral disc which contain fibrous cartilage. So we will talk some words about hyaline and fibrous cartilages. Hyaline cartilage is more elastic but less durable. It occurs when the sternum is connected to the ribs, such as first rib. An example of synchondrosis organized by fibrous cartilage is intervertebral cartilage. In the center of the intervertebral cartilage is the nucleus pulposus, a viscous, semi-liquid substance under pressure between the vertebra and the whole spine, and peripheral part of the intervertebral disc is represented by the annulus fibrosus. Here, through the thickness of the basic substance of the cartilage, bundles of collagen fibers located in concentric rows and differently oriented from the one cartilage to another penetrate. So, next classification include period of development cartilaginous tissue. There are two parts of synchondrosis. First is temporary, next, at last, is constant. By the duration of the existence of synchondrosis are divided into permanent and temporary. The former exist throughout life. Most exist only at a certain age. They are replaced by bone tissue. An example of this synarthrosis is the epiphyseal cartilage, which exists until skeletal growth ends. Between separately ossifying bone fragments, maybe pelvic bone, femoral bone, etc. The next group is constant synchondrosis, and I told you earlier about intervertebral disc, such as example of constant synchondrosis between two bones, two vertebral bodies. Next type is hemiatrosis or symphysis. They are called symphysis and represent an intermediate form between joint and cartilaginous continuous connection. These connections include the pubic symphysis. You may see this part of hemiatrosis on this picture. These connections contains in the center of the cartilaginous layer small gap filled with fluid. This is a solid fusion, which is very important because the pelvic ring carries an enormous axial load. When the human body is standing, compressive force act on this fusion and when sitting stretching. So, at the same time, the presence of a cavity allows the pubic bones to diverge at least a little, which is especially important for women who due to this increase the size of the exit from the small pelvis. And next we will talk about diarthrosis. In the joints which represent younger formation in phylogeny, since they arose in the connection with emergence of animals on land, the structural features minimize the obstacle to movement. True joints are those joints of bones in which the function of movement comes to the fore. Mandatory elements of the joint: articular surfaces or fascious articulars, facies articularis, articular capsule, articular cartilage, articular cavity, and synovial fluid. And you may see these terms in Latin. 5 mandatory elements of each joint: facies articularis, cartilago articularium, capsula articularis, cavitas articularis, and synovial fluid. So the articular surfaces is located on the bones involved in the formation of the joint. One surface, as a rule, is convex. This is the articular head. The other is concave, the glenoid cavity. A convex surface always has greater extent than a concave one. Both surfaces are covered with articular cartilage. Along the edge of the articular cartilage, the fibrous layer of the periosteum continues directly into the surface layer of the cartilage fibers. In most cases, this is hyaline cartilage. An exception is the fibrous cartilage of the articular surfaces in the temporomandibular or sternoclavicular joints. Articular cartilage has a different thickness not only in different joints, but also in different places of the same joint. The thickness of the cartilage depends on the function of the joint and ranges from 2 per 100 to 6 mm. The cartilage on the glenoid cavity is softer than one of the articular head. At the edge of the articular surface, the cartilage is thicker than in the center. Joints that carry a large static and dynamic load are distinguished by a thicker layer of articular cartilage. Cartilage is thicker in active joints than in inactive joints. If the muscles that act on the joint are affected by any diseases, then the cartilage becomes thinner. Articular cartilage is firm and elastic. It is characterized by less strength than bone, but more elasticity. With varying loads, the articular cartilage becomes thicker in some places, thinner in others, deforming without changing the volume. In the bent knee joint, when a person sits at the apex of the condyles of femur, the cartilage is 5 mm thick. The articular surface is more convex. When a person stands up and takes an upright position, the weight of the body loads the articular surfaces of the extant knee joint, and the cartilage on the condyles become thinner per up to 2 mm. In this case, the articular surface is flattened, and consequently, the contact surface of femur and tibia increases, and the adhesion forces between them increasable. Changes in cartilage thickness are one of the adaptations of the shape and structure of joints to function. On microscopic section, in the articular cartilage zones can be distinguished four parts. First, the surface area of the articular cartilage. It accounts for 10%. It forms a transparent, shiny plate. Next, second, the intermediate zone is the widest 50%. The main substance of the cartilage contains groups of 2-3 cartilage cells surrounded by the matrix of connective tissue fibers. Third, deep zone is 20%. It contains the most collagen fibers. Fourth is zone of calcification bordering with bone tissue. In it, collagen fibers are woven into the bone tissue, connecting cartilage with it. Articular cartilage does not have blood vessels. Therefore, due to malnutrition, a lesion occurs there, deforming arthrosis when degeneration of dystrophy of cartilage tissue occurs. So, the joint capsule or capsula articularis hermetically seals the joint cavity from all sides. The capsule passes from one bone to another. Attaching itself along the edges of the articular surfaces. In the joint capsule, the inner synovial and outer dense fibrous layer should be distinguished. The inner layer of the joint capsule, the synovial membrane, consists of loose connective tissue, rich in blood vessels, lined with a single layer squamous epithelium from the side of the cavity. The synovial membrane ends at the edge of the articular cartilage, where there are special outgrowths, synovial villi, which ensure the formation of synovial fluid. Villi can calcify, then special formation appear in the joint articular mice, which greatly impede the work of the joint. In addition to the villi, the synovial membrane can form synovial folds and protrude into the joint cavity. You may see the folds here on this shoulder joint. In addition, the synovial membrane can bend outward, forming a synovial bursa or recessus. They are located in the circumference of the joints, in the places of greatest friction, under the muscles or tendons. The synovial bursa may or may not communicate with the joint cavity. In large joints, the synovial membrane can form more or less closed cavities, the turns or recessus of synovial membrane. Such twists are found, for example, in knee joint. It's necessary to remember about the presence of synovial bursa, since they are affected when the joint is damaged, and vice versa. The diseases of even the smallest synovial bursa can lead to joint disease. The surface layer of joint capsule is the fibrous layer. It consists of course of bundles, collagen fibers. This is essentially the transition of the periosteum in articulating bones. The outwardly located fibers are oriented longitudinally. These bundles of fibers grow into the bone through the periosteum in certain areas. Fibers located in depth and oriented obliquely or transversely. In joints that perform extensive movements, the capsule is thinner, like this in shoulder joint. Joint capsules can become denser when additional bundles of collagen fibers develop in the fibrous layer, forming its so-called intercapsular ligaments. For example, is the anterior part of the capsule of hip joint. We'll see it later. For example, in the anterior part of the capsule of hip joint, a powerful intercapsular iliofemoral ligament is visible. So, next we will talk about joint cavity and fluid. The joint cavity is filled with synovial fluid, which is produced by the synovial membrane. It is a viscous fluid that, like lubricant in cars, coats the articular surface and reduces friction during movement. Joint friction is very low. The synovial fluid is based on blood plasma components coming from blood vessels of the synovial membrane. In addition, products of wear and tear, abrasion of the articular cartilage, and the synovial membrane itself are dissolved in it. The dry matter of synovia accounts for about 6%. The rest is water. The main components of the liquid that regulates the viscosity is hyaluronic acid. Synovial fluid not only reduces the friction of the articular surface during joint movement, but also participates in the nutrition of the articular cartilage. Articular cartilage, unlike other tissues, does not contain blood vessels. I told you about this, and is nourished mainly through the synovial fluid. The mechanism of fluid intake is regulated by the work of the joint. If the cartilage is compressed, then the liquid is squeezed out of it. The coefficient of friction increases. After removing the load, the cartilage absorbs the fluid. The coefficient of friction decreases. To squeeze out the lubricant, a constant slight movement of the articular surfaces is required. Thus, the main functions of the synovial fluid are the following: locomotor function, providing together with the articular cartilage free movement of the articular surfaces; metabolic, participation in the intensive exchange processes between the contents of the joint and vascular bed; trophic, mainly in relation to the peripheral avascular layer of the articular cartilage. So, in addition to the main elements, there are auxiliary elements of the joints. So, you may see next at auxiliary elements: ligaments, ligamenta, discs, meniscus, lips, cartilaginous lips, bursa, pleats or folds, tendons, that's part of muscle, recessus, and corpora adiposa or fat pouch. So, discs and menisci are plates formed by hyaline or fibrous cartilage located between the articular surfaces of the bones. On this picture you may see menisci of knee joint, medial and lateral menisci, and also you can see disc in temporal mandibular joint. If the cartilage completely divides the joint cavity into two floors, then we can talk about disc. And I told you about temporal mandibular joint. If the division of the joint is incomplete, then we are talking about meniscus, and I told you about menisci and knee joint. The meniscus of the knee joint is lunate, or crescent-shaped, curved cartilaginous plate reinforced with special ligaments. They contribute to an increase in the area of contact of the articular surfaces, make the joint more stable and durable, and increase the range of motion. Menisci also act as a buffer. They are very durable. Their damage occurs, as a rule, under the action of an indirect force during a jump while relaxing. For example, in knee joint, the medial meniscus is less mobile and injured more often than the lateral one. Meniscus injury usually occurs when the fixed leg is unexpectedly stretched or rotated, often when skiing, skating, or playing football. Tearing force can result in the meniscus tearing or tearing away from the attachment side. With an acute injury to the meniscus, pain occurs immediately after the injury, while the person prefers to keep the leg in a bent position. Age-related degenerative changes in the menisci are enhanced by excessive load and angular deformities of the knee joint. So the labrum is usually labrum or lips. You may see this on hip joint and shoulder joint. Okay, the labrum is usually formed by fibrous cartilage located along the edge of the cavity, has an alveolar shape, deepens the glenoid cavity, provides greater congruence. The labrum is located in the shoulder and hip joints. There are ligaments to straighten the joints. Their combination form the ligamentous apparatus. In relation to the joint capsule, there are three types of ligaments. Intra-articular ligaments, formed by a bundle of collagen fibers, which is located in the articular cavity. And for example, you may see ligament of the head of femur, ligamentum capitis femoris is in Latin, or crucial ligaments in knee joint, ligamentum cruciatum anterior and posterior, or ligamentum cruciforme. Capsular ligaments is second group, are a thickening of the joint capsule. And you may see zona orbicularis in hip joint. And also uh, extracapsular ligaments located outside the capsule but often woven into it. And you may see collateral ligaments in capital joint and knee joint, collateral ligaments. What is the functional purpose of the ligaments, or ligamenta in Latin? They straighten the joints, but most importantly, they inhibit movement in order not to exceed physiological limits. That is, so that joints do not become loose. When these limits are still exceeded, we are surprised when looking at yogis or athletes. This is achieved through years of painful training. Ligaments not only slow down but also direct movement. In the elbow joint or cubital joint, in principle, flexion, extension, and lateral movements are possible. However, we can only bend and extend the limb at the elbow joint. Lateral movements are impossible because the lateral ligaments, medial and radial and ulnar collateral ligaments of the elbow joint are tightly bound and direct to movement only as flexion and extension, preventing adduction and abduction. The inhibitory function of the ligaments is combined with the work of the muscles. On preparation by removing muscle and leaving ligaments, the range of motions is always greater than that of a living person, which is due to muscle tone. Many muscles begin directly from the ligaments and when contract make them more elastic, for example maintaining the arch of the foot due to the tension of the short muscles of the foot and lower leg. Also, you can see fat pouch or corpora adiposa in pleats of knee joint. And also you can see bursa of knee joint on this picture. So if we talk about bursa, we must talk about the parts of synovial membrane in joint. So the synovial bursa may or may not communicate with joint cavity. And you may see the synovial bursas of knee joint which communicate the cavity. So next we will talk about motions in joints. There are motion through frontal axis, they call flexio and extensio. Motions through sagittal axis, this is abductor to lateral position and adductor to medial position. And motion around axial part or longitudinal axis is rotatio or rotatio in Latin. This is supinatio to lateral side and pronatio to medial side. And motion circle round it is circumductio in Latin, like a swimming motions of our hands. So next we will talk about classification of diarthrosis. First classification is about number of articular surfaces. They are simple, complicated, combined and complex articulations. In a simple joint, two bones are articulated. For example, the head of the humerus and glenoid cavity. Also you can see simple joint between two metacarpal, between two bones. First is metacarpal bone, and second is the basic part of finger bone, phalanges, proximal phalanges. A complicated joint is one where three or more simple joints are articulated, surrounded by a common capsule. For example, is elbow joint. You can see three simple articulation in common capsula in elbow joint. It contains three simple joints. First is, I taught in Latin, articulatio humero-radialis. Next is articulatio humero-ulnaris. And the third is articulatio radio-ulnaris proximalis. 3 in 1. Next, complex joint. Complex joint. Complex joint in which the cavity is completely or partially divided into two parts by an articular disc or meniscus. Such a joint has functional features. Since the shape of the articular disc is usually biconcave, both sides of it can be considered as articular cavities that are articulate with the articular heads. In this case, the movements in both parts of the joint can be different. And you can see, for example, temporomandibular joint with disc between two articular surfaces with cartilaginous part. A wide variety of movements, the mandible, when biting off and chewing food, is due to the presence of cartilaginous disc inside the joint. For example, when lowering the mandible, its head rotates in the lower part of the temporomandibular joint, and the upper surface of the articular disc slides along the articular surface of the temporal bone, so that the disc moves to the articular tubercle. Thus, the disc complicates the mechanism of movement in the joint. Combined joints are distinguished on a functional basis. A combined joint is two or more anatomically separate joints that anatomically separated, however function is constant. Temporomandibular movement in the right is impossible without movement in the left temporomandibular joint. Looking at the joint, and it can be seen that the articular surfaces have different shapes. So, next classification is about shapes or articular surfaces. And we have three parts of joints. First, an axial joint. And there are two shapes of anaxial joints. Pivot, such as Articulatio crugalis or ankle joint, and hinge. You may see interphalanx joint in our fingers. Next, biaxial joints, biaxial with two axes of movements. There are three shapes: ellipsoid, saddle, and condyloid. And for example, you may see these joints. Ellipsoid joints is a wrist joint or carporadial joint, wrist joint is ellipsoid shape joint. Saddle joint is joint between collarbone and breastbone. Articulatio sternoclaviculare, and condyloid joint is knee joint. All of them are biaxial joints. And next is multi-axial joint. There are three shaped joints: spherical first, and for example this is shoulder joint because the head of humerus bone is like sphere. Bow-shaped joint is the joint between femoral and hip bones, or hip joint, is articulatio catilica in Latin. And flat joint is the joint between sacral bone and ilium bone. And you may see the flat surface, and you remember flat surfaces in lateral part of sacral joint, sacral bone and ilium bone. The shape of the articular surfaces determines the types of movements of the joint. According to it, its functional features can be determined. Joint movements are possible around three axes. Bending or tilting, forward and backward bending occurs around the frontal axis. Around the sagittal axis, movement away from the body. And you may see it on this picture. I repeat, bending or tilting, forward and backward bending occurs around the frontal axis. Around sagittal axis, movement away from the body, abduction, abduction, and reverse to it towards to the body adduction. Rotation around the vertical axis, turning inward pronation, outward supination. They also distinguish circumduction. With this movement, the limb describes a cone passing from one axis to another. And I told you about swimming, where we have circumduction movement. So, next we will talk about articular surfaces, and I repeat their terms in Latin. So, we see an axial joint like pivot, hinge joint. In Latin is articulatio trochoidea, and you may see the picture of scheme of this articulation or this joint, and also you can see hinge joint. It's in Latin ginglymus, and you may see it on this picture. It's elbow joint, elbow part of this concert joint is the connection between trochlear humeri and incisura trochlearis ulnar bone. So biaxial joints are ellipsoid, saddle, and cantilever shapes. Ellipsoid, articulatio ellipsoidea, and you may see a wrist joint. Saddle joint is articulatio sellaris, like saddle or the horse, and you may see the joint between first metacarpal bone and trapezium bone. And counterweight joint or articulatio bicondylaris, I showed you, is knee joint. And so multi-axial joints have spherical bow-shaped and flat shapes. So spherical shape joint is shoulder joint. Bow-shaped is hip joint, and flat joint is like sacroiliac joint, and this is non-movement joint. The movement in this joint is very, very limited. Next, we will talk about classification, about congruence of articular surfaces. So, the degree of coincidence, there are two parts of classification. First is congruent joints and incongruent joints. In first part, congruent joints, the shapes of the articulating surfaces of the bones correspond. And in incongruent joints, the articulating surfaces do not correspond geometrically or in size to each other. They always have auxiliary elements, discs, menisci, cartilaginous, labrums, and others. So you may see, for example, shoulder joint, and the head of humeral bone is more than the articular surface of glenate part of scapula. So we talk about functions of congruent and incongruent joints. The pivot joint is the simplest congruent joint in which the articular surface of the bone is in the shape of a cylinder, and the articulating surface of the other bone is the shape of a cavity. The cylinder has one single axis of rotation, which corresponds to the long axis of the articulating bones and runs vertically. These are unaxial rotational joints. A classic example, you may see a cylindric joint, pivot joint on this picture. A classic example is the articulation in the radio-ulnar joint, where the movement is inward pronation and outward supination. The Atlanta-axial joint also belongs to this type. There is another form of an axial joint, hinge joints. The hinge joint is designed like a door hinge. The axis of convex articular surface is here perpendicular to the axis of the bone itself, and the block of the cylindrical surface is here perpendicular to the axis of the bone itself. Perpendicular to the axis of bone. You may see it on this picture. In the block, the cylindrical surface has a groove in the middle, and its concave surface has a ridge. Groove and ridge prevent side slip. Block devices have articulated joint surfaces between the phalanx of the fingers. It should also highlight screw-shaped joints or block-shaped joint with screw deviation. Here the groove is located slightly obliquely. With the continuation of this groove, a screw is formed in a spiral, for example, the elbow joint. In this kind of joints, for example, in the Atlanta-occipital movement of the head forward flexion and backward extension, around the frontal axis, the lateral movements around the sagittal axis, abduction and adduction, are possible. Saddle joints also belong to biaxial joints. These joints are convex in one direction and concave in the other. Imagine that you are sitting astride a horse with your legs wrapped around its torso. You can move forward and backward, right and left. The movements in the saddle joint also occur. An example of such a joint is the carpometacarpal joint of the thumb. Here movements around two axes are possible: abduction and adduction of the thumb. You can see it in my hand, adduction and abduction, and opposition, opposite to other fingers, opposite movement of thumb opposite other fingers. The counterweight joint is a type of joint in which one of bone is connected to the other through two separate surfaces. Each of these articular surfaces is called the condyle, whether it is concave or convex. The shape of such a joint is intermediate between ellipsoidal and hinge-shaped. The knee joint has this shape. In the knee joint, movements around two axes are possible during flexion in the joint. The next type of congruent joints is polyaccel or multi-axial joints with many axes. Balanced circuit joints, or one articular surface forms a spherical head, you may see this on this picture. The other forms a corresponding concave articular cavity. In theory, movements can be performed around a set of axes and coincide with the radii of the bone. Practically, among them, there are three main axes along which movement is carried out: frontal flexion and extension, sagittal axis perpendicular to it, abduction and adduction, and vertical or longitudinal, perpendicular to both first axes, rotation inward and rotation outward, pronatio and supination. In addition to these three movements in the spherical joint are possible along any other axis that occupies an intermediate position between the three mutually perpendicular axes of movement. Finally, only the spherical joints have movement that's called circumduction or circular rotational movement, like in swim, in which each point of the limb passes a circle and the entire limb as a rule describes a cone or round. As a rule, the ball and socket joints or spherical joints, the capsule is extensive, non-stretched by ligaments, which contributes the mobility of the joint. For example, the shoulder joint, formed by the head of the humerus, I told you, and the granite cavity of the scapula. And you may see this. And it has no ligaments. The bowl-shaped joint or cartilaginous joint is a type of spherical joint. It's built so that the head of the bone is in a deep fossa, such as acetabulum in hip joint. Along the edges of the cavity is the articular labrum, which further covers the head of the bone. The movements are carried out along many axes, but they are limited. Flat joint. In its articular surfaces are slightly curved, represent segments of the circumference of a large bone. Therefore, movements on such joints are performed around all axes, in the form of sliding with slight displacements, for example, between the articular processes of vertebra, between sacral and iliac bones. Combined, the range of motion of many of these joints provides a large range of motion for bones, which allows circular motion, such as in vertebrae. So the movements in the congruent joints are determined first of all by the shape of the articular surfaces. They have limited movement in these joints. In addition, the amount of movement in these joints depends on the difference in the size of articulation surfaces. However, there are a number of joints in which the shape and size of the articular surfaces of the articular bones do not correspond to each other. They are incongruent joints. This disparity is leveled out by various adaptations. For example, the elasticity and the ability to stretch the joint capsule, the presence of interarticular cartilaginous discs and meniscus, movement of the synovial fluid during movement, which plays the role of liquid meniscus. In incongruent joints, synovial fluid plays an important role, which moves from one part of articular cavity to another and allows various movement, and not only those that are determined by the direction and shape of the articular surfaces. The main factor on which movements in incongruent and congruent joints depend are muscle contraction, the activity of which is controlled by the central nervous system and especially the cerebral cortex. So, next we will talk about mobility factors. So, there are several factors, and we talked about difference of areas, and next is congruence, axillary elements, capsule, cartilage tissue, synovial fluid, and physical activity level and age. So at the end of the lecture, I tell you about obsolescence term syncercosis is bone connection with muscle tissue. And for example, you can see the connection between vertebral column and scapula or shoulder blade bone. There are two muscles, lesser and greater rhomboid muscles. And we will study their muscles and all the muscles in myology. It's a part of anatomy which study skeletal muscles. So now I finish my lecture. Thank you for attention. Goodbye. See you again next time.